Hello my friends, my name is Dr. Bradley Austin and I am here to share my knowledge of the eyes with you. So just to kind of get started, I want to let you know what this first video is going to be about, what my channel is going to be about, and kind of take you on this journey with me as we explore the eyes and understand more about ourselves as human beings and our souls in general. What I did recently is I reached out to my patients at my office and I asked them to kind of help me with getting this first video started by providing me questions that they might have about the eyes or about the field of optometry in general. And what I did was I'm going to be putting together the top 5 most commonly asked questions that I got in order to pretty much answer what everybody is kind of wondering about their eyes and about vision and about optometry. And so based on the questions that I received and also some experiences that I've had as working as an optometrist for the last 5 years, I'm going to be answering some questions about what I find are the most commonly asked questions, at least within my own practice. Now, I'm kind of extrapolating here because I'm going to assume that what is asked in my practice is probably indicative of what's asked just about anywhere else as well. So these questions are by no means the most important ones or the most asked questions of all time, but just through my experience, some of the ones that I really wanted to touch on and focus on and that my patients seemed interested in finding out, and so I wanted to share them with you guys. So let's go ahead and get started. What's going to be important for you to keep in mind is that although I am, yes, a medical professional, again, I am not here to diagnose anything, and anything that I say should be taken obviously with a grain of salt. Use your best judgment in terms of what fits best for you and your situation. My goal here is to share knowledge about some basic concepts with the eyes, vision, and optometry so that you can better understand your own health and be kind of more informed so that you can make better decisions for yourself and for your family. So if there's any particular issues, any particular questions that you have, make sure to please comment down below, let me know what you think, but also reach out to your own local optometrist and make sure you're keeping up with your regular exams. That's the best way to keep track of the health of your eyes. Alright guys, so question number 5 is, how do your eyes change over time? So to answer that question, what you have to first understand is that the way your eyes change over time is based on the way your body changes over time. So if you think about your arms getting longer or your feet growing, your eyes go the same way. Your prescription more or less is based on the actual curvature on the surface of your eye. So whether you're nearsighted, farsighted, whether you have astigmatism, those types of things are based on the actual surface curvature of your eye as well as the actual shape and size of your eyeball. So the larger your eyeball, more likely you are to be nearsighted. If you have a smaller eyeball, then you're probably going to be farsighted. It's not that cut and dry, but those are kind of basic guidelines to it. So as time goes by, if you're starting off with a fairly nearsighted prescription, a small nearsighted prescription to begin with, maybe a -0.5 or even a -1, it can change over time as you go through puberty and as you change and grow over time, because your eyes adapt and change as you grow. Now, one thing that definitely plays a factor in how your prescription changes over time is how you use your eyes. Now, I don't want you to feel that, oh, if I read books or if I spend too much time on the tablet, if I'm on the computer a lot, it's going to make your eyes get way worse and make you go blind. It doesn't work that way. If you're using your eyes more, your eyes are going to get fatigued more quickly, more easily. If you're spending a lot more time doing near activities, you're sending signals to your brain that you like doing things up close, and so over time, it causes your eyes to change and adapt in a way that allows you to do the things that you habitually do. So the way you use your eyes helps to determine what kind of prescription you're going to have moving forward. Now, if you're already nearsighted, doing far away activities and looking off into the distance is not going to make your prescription reverse and go back to 0. Unfortunately, it doesn't work that way. You may help to slow it down a little bit, That's something that we call myopia control, and there's a whole field of research on that particular area. I'm not going to get into that right now because that's a whole different topic for a different day, but it is definitely something that you can look into if it's something that you're interested in. For the most part, your prescription will change however it feels like changing. Your eyes do what they want to do. The glasses, the contact lenses, and all of the devices that we use are simply meant to help you with whatever issue you have at that particular moment in time and help you to see as clearly as possible. Using glasses, using contact lenses does not make your eyes get worse. One of the other most important things about how your eyes change over time is that when you get to the age of about 40 to 45, pretty much everybody develops something called presbyopia. And what that means is that your near vision starts to get worse. I'm sure you probably have found yourself doing one of these where you feel like your arms aren't long enough to be able to read the paper anymore. Trust me, it happens to everybody. So don't feel worried and don't feel scared when it happens to you, because it's entirely natural and it's a part of life. Now, there are one of two mechanisms by which we think this happens. Either the lens inside the eye gets harder and it doesn't change shape to be able to focus as well, or the muscles inside the eye get weaker. We're not sure exactly which one it is, but we do know that your ability to see up close does deteriorate slowly, and it happens over the course of about 12 to 15 years, where your near vision gets continually worse. Now, some people get it a little bit earlier, some people get it a little bit later, some people may not have that issue at all. Everyone is a little bit different. So you need to have a one-on-one conversation with your own optometrist to determine what kind of issues you have and what the best solution is going to be for you in your particular case. So question number 4 is, what is astigmatism and how is it corrected? So you have nearsightedness, farsightedness, and astigmatism, also presbyopia. Nearsightedness is obviously the ability to see up close but not far away. Farsightedness is the ability to see far away but not as well up close. Nearsightedness is pretty cut and dry. You see up close and that's about it. Can't see anything far away. Farsightedness is a little bit more complicated because you can see far away, but maybe with a little bit of blur. You can see up close, but with a little bit more difficulty, a little bit more strain on the eyes. It can oftentimes cause headaches and fatigue. So it kind of flies under the radar sometimes because people don't always know what it is. But for astigmatism, it can happen in either case. You can be nearsighted with astigmatism, or you can be farsighted with astigmatism. Because what astigmatism actually is simply means that you have two different prescriptions in the same eye. So somebody who is nearsighted only, imagine that their eye is shaped almost like a basketball. It's the same curvature all the way across. There's no difference in shape, so that no matter where the light comes from, that light is all being focused to the back of the eye in one spot. Your eye works almost like a magnifying glass. Imagine that light comes in from the front. This is the front of the eye, this is the back of the eye, and it all focuses into one sharp spot. Now, if you have the ideal perfect curvature on the surface of your eye, you don't need any prescription at all whatsoever. Light hits the surface, focuses to the back of the eye, everything is nice and clear. If you're nearsighted, the surface of your eye is actually too curved, and therefore it focuses the light too much, causing that big circle of light to hit the back of the eye and cause blurry vision. If you're farsighted, then that light is not focused enough. Same issue, circle of blurry vision. When you have astigmatism, imagine now that your eye is shaped like a football. You have two different curvatures on the surface of the same eye. And because of that, it changes the way that the light is being focused depending on where the light is actually coming from. So therefore, you have distortion in your vision at pretty much all distances. And the greater the amount of astigmatism that you have, the greater the distortion that there's going to be. Alright guys, so question number 3 is, do multifocal contact lenses work for everybody? Now, what are multifocal contact lenses, you're wondering? Those are lenses that allow you to see distance, intermediate, and near vision with the same lens. So in many cases, you have just normal single vision contact lenses that allow you to see far away. When you get to the point where you develop what's called presbyopia, or the inability to read up close, usually you'll know when you're needing reading glasses or you have a hard time seeing up close, usually beyond the age of 40 to 45, that's when multifocal contact lenses would be a good option for you. Now what you want to do is find a doctor that's going to be able to fit you with these lenses, because they are a wonderful option and one of the best ways to maximize your range of vision from near to far. Now you also have monovision, which uses one eye that sees far away and one eye that sees up close. Both of these types of lenses utilize the power of the brain to be able to help you see clearly. Now here's the beautiful thing. Your brain allows you to see near and see far by actively suppressing the parts that you do not need. So if you're using monovision, where one eye is distant and one eye is near, whenever you're looking far away, your brain is actually completely blocking off the vision from the other side and only utilizing what it needs. In the multifocal lenses, it's a little bit more complex. Because both eyes have the same thing, distance, intermediate, and near, the brain is actually utilizing the parts of the lens that are clear for whatever distance you're looking at, and then ignoring the parts of the lens that it doesn't need at that particular moment in time. So that's how the multifocal lenses work, and they are a great option for getting the range of vision that you need, especially if you feel like you haven't been able to wear contact lenses anymore because you've lost your near vision. These are something that you should be looking into for getting back to the contact lenses that can really help you maximize your vision and truly have the best quality of life. Alright guys, so we're getting close to the end. Question number 2 is, are there eye exercises that can help to improve your vision or strengthen your eye muscles? So this is actually a pretty big one, and there's a lot of information out there about different exercises or different things that you can do to try and improve your vision or try to improve the strength of the muscles in your eyes. And the first and most important thing that you have to understand is how the muscles in the eye actually work. You have what's called extraocular muscles. These are the muscles that sit around the outside of the eyeball, and these muscles do not do anything to actually affect your vision. The only role that they play is in moving your eye from one position to the next, moving them up and down, moving them left and right, rotating them slightly, but they have no impact on your vision. So when you hear things about moving your eyes in certain directions is going to help improve your vision, unfortunately that is not true, because those muscles have no impact on your vision. What you can do in some cases, if you have a lack of ability to focus up close or lack of ability to focus from near to far and move back and forth quickly, there are some things that you can do to help strengthen that. And there's an entire field in optometry and in also the whole vision field called vision therapy, where there are exercises and different things that you can do to help improve your vision and help to improve your ability to focus. But for somebody who has normal vision, unfortunately, there really is not much of a way for you to be improving your eyes just by using exercises. The muscles in the eyes do not work like the rest of the muscles in the body. You can't go into the gym for your eyes, work them out, and come out with them being stronger. Unfortunately, that's not the case. So, question number 1. So again, this is in my own experience and in my own practice, what I found to be the single most important question, the one question that kind of reached the top of the list, is what is the single most important thing that you can do for the health of your eyes? And my answer to that question is getting them dilated. Now you hear a lot of times your optometrist is always going to tell you this, your ophthalmologist is always going to tell you this, whoever you're seeing is going to tell you that it is important to get your eyes dilated, but you may not necessarily know the reason why. Keep in mind, the dilation does nothing for us. It doesn't do anything for your optometrist, it doesn't do anything for your ophthalmologist. The sole purpose of the dilation is to let you know the health of your eyes, and it is probably the single most important part of the eye exam. So if you walk in and you say, well, I don't want to be dilated because it's not comfortable for me, or I don't like the way it makes me feel, all you're really saying is, I don't want to know the health of my own eyes. Our goal as your primary care eye physicians is to take care of the health of your eyes and let you know how everything is doing. And the dilation is the best way for us to do that. There are so many things that go on in the back of the eye that you would never even know or feel because you have no way of knowing. There are no pain receptors inside the eyeball. So the only way that you know if anything is happening is when it starts to affect your vision. So that's why it's so important for us to get your eyes dilated, because we put a few drops in you're blurry and a little uncomfortable for a few hours, but you go back to normal and you leave the office with the peace of mind knowing that your eyes are as healthy as they should be. And unfortunately, in some cases, you may leave the office with some bad news. But at least we are able to take care of what's going on and get you set up with the person who can take care of you best. Whether that means sending you to your primary care doctor or sending you to another specialist, an ophthalmologist, that can take care of whatever issues we found inside the eye. Our job as optometrists is taking care of the health of your eyes to make sure that you can stay healthy and continue using them for the long term. Alright guys, so that pretty much does it. Those are the top 5 most commonly asked questions within my own practice. Thank you very much for taking the time to watch my video, and I hope that you really enjoyed it. Please like if you learned something new today. Comment below if you have any questions or if you want to give me anything that you'd like to see in future videos, and please share with any of your family members or friends that you think would benefit as well. Please subscribe to the channel so you can stay tuned for even more videos to come. And again, at the end of the day, what I'm here for is just to share some of the things that I know through my experience with you so that you can better understand your eye health. But the most important thing is to keep up with regular exams with your own primary eye doctor so that we can always take care of you and make sure that you have everything that you need, that you're seeing as clearly as possible, and that you're staying as healthy as possible. So again, my name is Dr. Bradley Austin. It's been an absolute pleasure, and together let's learn, grow, and change the way we see the world. Thanks guys, and I'll see you in the next video.